Hello and welcome to London Upper Limb Surgery. I am Karthik Karuppaiah, consultant orthopedic surgeon working at King's College Hospital, London. This video is about management of advanced thumb-based arthritis, also called as carpometacarpal joint arthritis or trapeziometacarpal joint arthritis. A 50-year-old right-hand dominant lady came to my clinic with pain, discomfort, and the inability to use her left hand because of the arthritis affecting her left thumb. She exhausted all the conservative options, and when she presented to me, she has severe deformity affecting her thumb. If you look at the radiograph with the yellow arrow, you can see that she has severe arthritis affecting the carpometacarpal joint, and she also has subluxation of this joint. Because of the arthritis affecting this joint, she developed a bit of adduction deformity of the thumb, which led to secondary deformity in her metacarpophalangeal joint of her thumb, which you could see in another radiograph with a red arrow, where she has subluxation of the joint and the instability of the thumb metacarpophalangeal joint. This is her before the surgery, where she explains the deformity, what she has in her hand, and also the limitations that she has in the function in her left hand. Okay, can you turn your hand the other way? You could see that the thumb is almost dorsiflexed to about 90 degrees, and it was very floppy when I tried to move the thumb. The other fingers. Okay, so tell me, what are the main problems you have in this hand?
It's mainly things like, so I used to care for my dad, and he was on a lot of medication, and popping the pills out of the packets and that sort of thing was just so difficult because you couldn't put any pressure on it.
Okay.
So it's anything that anything that requires any kind of
using your thumb,
dexterity with your thumb it's useless. It's very annoying.
Okay.
Opening bottles, that sort of thing.
Okay. Are you right-handed, left-handed?
I'm right-handed.
Okay. But, so this hand, what are the things you couldn't do? You told that in the tablets and stuff.
So
anything else?
I tend to, so if I'm opening a bottle, for example, I tend to hold it in my right hand and open it with my left, but I can't, there's no kind of pressure to push against, so it's just pretty useless, really.
Okay. What about driving?
It's not too bad driving because we've got an automatic.
Okay.
It is a bit more tricky. I drove in your mum's car the other day, which is a geared car, and that.
You don't. I mean,
it's okay, but you don't have as much grip.
Okay. So, considering the complexity of the problem in her thumb, and as she has left it too long, we decided to go ahead with a complex reconstruction of her thumb, and at the same time trapeziectomy. So if you look at the x-rays here, you could see that we have done 3 different procedures. One, we have removed the trapezium, which is a gold standard procedure for most of the trapeziometacarpal joint arthritis, after which we have stabilized the thumb and the index finger using tight rope. You could see strong suture holding these two metacarpals. It's extremely important to give a good pinch grip for the patients. And since she has quite a bit of instability of her thumb with subluxation to almost a dislocation, we decided to fuse the thumb so that she has a stable thumb which she could use to have a good power and a pinch grip. And the video on the right is at 3 months, where you could see that she has good movements back in her hand. Middle index. Okay. How stable is your thumb now?
It's much more stable than it was before.
Okay, and you can use it a lot.
Yep.
more. Okay. And the other video is at the final follow-up, where you could see that her function is pretty much back to normal in her hand. Yeah, that's fine. So, when compared to how it was when we started in October, what are the things you could do now with your thumb?
Well, I can use it in a way that I couldn't before, so I can now put pressure on it without it just flopping backwards. So
Yeah.
I can use it to,
Driving,
driving's fine. Most things are fine.
household works are absolutely fine.
Yeah, absolutely fine.
And you
And I can
can.
grip. Much more functional than it was.
That's good. She's pleased with the outcome of surgery. She has got almost normal function back in her hand. Her power grip and the pinch grip is pretty much similar in both hands. Before the surgery, she finds it difficult even to hold a key to open a door or hold a credit card and put it in the ATM machine. However, she could now use her hand to do all these activities without any restrictions. Thank you.